Hey guys, it's Dr. Kelly from Iowa Family Chiropractic. As many of you know, I'm currently pregnant. I'm in my second trimester. And in addition to chiropractic care during your pregnancy, we always recommend some stretches and exercises for two reasons. One is to keep mom comfortable, to keep her feeling good. There are a lot of discomforts that sometimes come with pregnancy that are very much avoidable with the right exercise, the right care. And the other reason we prescribe those exercises is to make sure that mom's body is ready for labor and delivery, that the baby is in the right position, that baby comes out as easily as possible without intervention, without the need for forceps and vacuum and C-section and things like that, and also to decrease pain for the mom. So I'm going to show you today one of the exercises that we have pregnant moms do during their pregnancy. We recommend that you start at least in your second trimester. There's no harm to doing this in your first trimester, but the reason we don't recommend waiting longer than that is because of course, in our third trimester, we're carrying a lot more weight, we're a lot bigger, our center of gravity has shifted, and it's more difficult to get started on this one. So if you start when you're not quite so big and so out of balance, it's easier to do in your third trimester. So I'm going to show you what we call inversions. This is actually from the Spinning Babies website. So if you want to go onto Spinning Babies, there's 3 different exercises that we recommend that are actually from their website. So you can go on there and get instructions, but I'm going to show you how to do these. They're very simple. You do want to make sure you're doing these exercises with someone home because when we go upside down, oftentimes we become a little bit dizzy. Your blood pressure might shift a little bit, and it's normal and common, and most of the time not a problem at all, but just in case, make sure you're not at home alone while you're doing this. And then you can do a couple things. You can use a bed, like a bed that's low to the ground, a platform bed or something like that, a chair, a couch, stairs, a stool, whatever's easiest. You just want to make sure you don't start with something that's too high. So you can see my chair. And what you want to do is just start yourself on your structure. And you're going to be going down. So as you can see, I don't have a huge belly yet. It's going to be pretty easy for me to go down. Start by going down to the structure first, and eventually you're going to go down on hands and knees. So once you're down here, if this is the farthest you can go, that's okay. This is still beneficial. If you can go farther, go all the way down to your forearms. And once you're down on forearms, you want to stay here for about 30 seconds. Which I'm not going to do right now. It's important, so if you saw how I just came up, it's important that you push yourself all the way up into that kneeling position again, rather than come forward off the chair. So oftentimes we have a tendency to, once we're down on the ground on our arms, actually just step forward off of the chair onto both feet. Don't do that. The purpose of this inversion exercise is to actually unwind your uterine ligaments, which can become very twisted during pregnancy. So when we go down forward, it kind of allows for an unwinding to happen, but really the most effective part of that is coming back up. So it's important that you swing back up into that kneeling position, and then you can get off of your chair or stool or whatever you're on. So if you want us to demo this for you in the office, or if you need help with it, please let us know. Otherwise, you can check out spinningbabies.com. Thank you so much for listening. Have a great day.